I have osteoarthritis and I was just given exercises. Now this is something I hear in clinic quite a lot. Someone will have gone to, say, the NHS physio and they'll have been given exercises with no manual therapy, and they will come in to see me having struggled with their exercises and so on, and they'll use that exact phrase, which is just exercises. The trouble with that is it's a negative kind of connotation of that word. Just kind of implies that they don't feel like that was enough, and they feel like it wasn't enough on the premise that they didn't really get any better. They were unable to really commit to their exercises. They didn't have a lot of faith within the practitioner who just gave them exercises. Now this is very interesting because there is a study that I looked at the other day which is looking at osteoarthritis of lower limbs, so hip and knee, and they were looking at the differences between having manual therapy and exercise, and also manual therapy on its own, and also just exercise on its own. Now basically there's always this debate, which is is manual therapy required? Is it needed? Should we be doing it? Is it just all about their rehab, their advice, the way they manage that problem, and so on? Now this study obviously isn't any surprise in what it found. So what they found is manual therapy used exclusively with no rehab only had short-term effect, no long-term effects, no real benefits to function, and so on. Now when they looked at a combination of short-term manual therapy and obviously the rehab done as well, they found that there was short-term benefit to pain in the group with the manual therapy applied, but there was no difference really long-term when you compare that group to the group who just had rehab, exercise-based, advice-based kind of approaches. Of course, the dilemma here is that a lot of people talk about this type of study and they will say, well, this proves that manual therapy has no long-term effect, so has no place in physiotherapy. It should all be about their rehab, their advice, their management of that type. Now, this is where I sort of slightly disagree, because the patients that come in and say just given exercises, straight away psychologically they are negatively thinking about just that approach. They feel like they're being shortchanged. They feel like they're not getting their full approach being managed in the correct way. So straight away we already know the effects of psychology on people's pain levels, people's sleep levels, their anxieties, their ability to commit to what you're telling them to do, for their belief in you as a therapist. You have to be thinking about, how do I get this person on board? Now, obviously, if manual therapy gives them short-term relief, they think that's amazing, and they are more likely to be able to do their exercises, and they're more likely to commit to them in the longer term. There's also something else that doesn't really get looked at here as well, is it's almost like saying there is no value to short-term pain relief. Well, as long as it's aligned with the long-term approaches of rehab and advice, then what's wrong with it? People will say, well, it's fostering the reliance on the therapist, so the person needs to have the treatment to feel good. Well, I think we're shortchanging people on this. I think there's loads of examples where people have things that they enjoy and they like, and they don't magically become addicted to it and are forced into it. As a therapist, we have to be open and honest with a patient. We have to be looking at them and say, these are the things, short-term benefits this will give you. This will help you with your exercise. This will make you feel better short-term, while you're applying the long-term approaches to your treatment. Obviously, what you can't say to them is, this is what we're doing with you. Short-term manual therapy, it will give you relief and it will get you better on its own. I think there's an element of, we need to do both. The short-term relief is still valid, because it's like saying, if someone goes with a headache to the pharmacist, goes, I've got a headache, the pharmacist turns around and says, it'll go away. What? Is that it? Like, they're not able to get anything to control my pain in the short term until it goes away on its own? Well, of course, that would be very immoral and unethical to deny that person that treatment which can help their short-term pain just because it doesn't benefit them long-term. I think we've missed the trick here. I think we've lost the plot, because it's like saying, you're going to have surgery. Okay, so do you want anaesthetic? Of course you do. Why? The long-term approach of this treatment, of the surgery, is going to be the same outcome whether you have anaesthetic or not. I'm joking in this case, but obviously, principalistically, the outcome of the surgery is the same, whether they were awake in agony or they were not noticing they were in pain during the surgery. So why would we deny that person that short-term pain relief? Even in something which has a negative effect, So, for example, having a tattoo. If someone has a tattoo, it can be painful. So you can put numbing cream on. However, we do know that numbing cream saturates the skin, and that means the ink is not as easily laid down into the skin. So it has a detrimental effect to the tattooing process. It means the skin might need to be worked over more and more to get that ink into the skin if there was numbing cream. So what does this mean? People will still have numbing cream, choose to pay for numbing cream and be allowed to use numbing cream during tattooing, even though it has a negative effect in the long-term outcome. So it shows you there's definitely rationale and reasoning and ethics and morals around the idea of short-term pain relief. And like you say, if it buys the person into the long-term approach, if it makes them trust you, and if they then say, oh, they didn't just give me exercises, they're more likely to do their exercises and work on that long-term. You've psychologically got them on the right page, and you're developing that alliance with that patient. You still have to be open and honest. You don't want to breed self-reliance on you as a therapist. You want them self-reliant on their own thing if possible. Obviously, certain conditions don't enable that fully. Osteoarthritis is degenerative. It gets worse as you get older. It's part of the aging process. So you are naturally expecting this thing to get worse. And somehow we're thinking that they won't need short-term intermittent treatments. I mean, that's another thing that doesn't really get discussed very much, because they don't look upon it this way. A totally different subject area is a patient of mine who's a home visit patient, seen by domiciliary physios 3 times, and because they weren't improving, they said it's no longer viable to keep seeing this patient. However, if it wasn't for me going in, she would deteriorate, go off her feet, end up with pressure sores, need district nursing, need treatment, need antibiotics, need to see a GP, could get a chest infection, then pneumonia, end up hospitalized, and all is that because it's like, ooh, we're not creating any real benefit in the long term with this person. We're also making them feel keeping them in a good place. So this big picture idea is often lost, and it's because we look at budgets individually rather than the whole view of the thing. So what I'm getting at anyway, going back to this particular study, is that it's my opinion that we shouldn't just throw away the idea of doing manual therapy just because there is no long-term benefit, because it's like saying headache, no reason to treat that because it'll go away on its own. It straight away makes sense to give people pain relief where you could give them pain relief. If that helps them to get on board with their long-term approaches, also enables them. Great example is some patients I've seen in the past. They'll have been treated in the short term, given their things to work on and manage long term. I won't see them for a decade because they've been able to manage great. And then randomly they reappear. And guess what happens? They come in and go, I've been doing great. And if I get a little bit of a tweak or flare up, I'll get onto my exercises, ramp them up, and it will dissipate. However, on this occasion, I couldn't do it. It was too painful. I was in too much spasm. I can't actually apply the movements. So I need you to try and bring the symptoms down short term to then mean I can get onto my exercises. Usually that needs 1 session and they're back on track. Don't need me again, off to go on their own. We're also forgetting compliance and discipline of people to stick to their rehab. If they're coming for therapy with a manual therapy approach, then you have a better chance of keeping them accountable to their rehab. You have a better chance of motivating them to stick to their rehab. You also have an ability to check that they don't get despondent with the idea that some of these rehab processes might be more for maintenance of their problem to slow deterioration of osteoarthritis down. These things are all very valid, but if you just give them exercises and off they go, you'll never ever know if they stuck to it. You'll never be able to make sure they stick to it. You won't be able to motivate them, keep them on the right track. And you might not be able to, if they do too much, you have no ability to bring them back in check again so they can get back onto their rehab. So I think this is becoming a problem. I think there is going to be more of a culture in physio, unfortunately, of people who go, we don't touch patients, we don't treat patients in that way, we just have to give them the right advice and exercise and send them on their way. Well, the problem is I think that's a minimalistic approach. I think it doesn't look at everyone individually. I don't think it looks at all of these things we've discussed in this video. So for me, I just thought I'll have a look at this research. The research is completely correct. It is short term only in the effect of the manual therapy, but alongside the other stuff, it has still got benefit. Obviously, this research can't delve into that, so it doesn't provide that as a kind of solution that it looks at in this case. But if you were to ask individual people, and we know the effect of the mind on the body is profound. If someone believes in a treatment, it's more likely to work. If someone believes in the therapist and trusts the therapist, it's more likely to work. So we can't just go, well, here's this treatment of, there's your exercises, off you go, because that might not be enough for everyone. Some people will go, oh, it was just exercises, as I've heard many times. Anyway, that's me ranting on long enough. That's it for this video, and I'll see you next time.